Decode MRCOG presents a small presentation on patient safety. We are coming up with individual domain and first being patient safety. Why patient safety first? It is one of the very important domain which is being tested in all 14 modules, and also many students find it difficult to pass this domain. That's the reason we are coming up with this domain first. Why one fails in patient safety? Not because of lack of knowledge. It is very rarely that you will be failing because of lack of knowledge. Many a times the students might have stress of examination which might affect their performance, so be stress free. An inability to demonstrate the required course clinical skills. How to overcome this? To overcome this, one needs to practice regularly, especially in relation to time management, and take a very good face-to-face course to build your confidence. This has been instructed, or this has been written by the Bible of MRCOG Part 3 book, Lisa Joel. Common pitfalls. What are the common pitfalls? Not understanding the role of clinical governance in promoting patient safety. Not understanding the use of audit in identifying the trends and systemic problems. Not understanding the duty of candor to provide apologies and explanation when care falls short of expected standards. These are the common pitfalls which has been seen in people or seen in students who are failing in patient safety. So what we are going to do now? Let's learn ABC of patient safety. A. So A being the first alphabetic letter, what are the points one should remember in A? Addiction and addiction services, allergy, anti-D, and admit in cases of emergency. B. The first one amongst B will be blood group. Breaking bad news. Be empathetic, sympathetic, and break the bad news in a sensitive manner, because here you are being tested also on patient safety. The best interest. The clinician will always work in the best interest of the patient, and that's the reason best interest, to identify what is the best interest of the patient who are lacking capacity, or in case of life-threatening emergencies. This is one of the patient safety point. And body mass index. C. There are many points in C. Clinical governance, audit, reflective practice, cancer pathway, a 2-week targeted pathway, confidentiality, consent, contraception, call for help at an appropriate time and are able to cope under the pressure while waiting for help to arrive. Clear understanding of the role of ST5 trainee to call for help, and involvement of seniors whenever necessary. Care bundle. Sepsis 6, acute kidney injury, placenta previa, care bundle plan. D. Datics. Documentation. Debriefing. Discuss discharge plan. Duty of candor. Demonstrate your ability to cope while help is on way. E. Equipment appropriate for an appropriate patient. Knowledge of electrosurgery, safe electroscopy, electrosurgery uses, enhanced recovery pathway following in elective gynae cases, examination in the presence of chaperone, escalation of care, emergency contraception, emergency contact details to the patient after the discharge or while having a consultation. F. Fails to take any responsibility for decision making and persistently defers to their consultant. Involving consultant for small decision which can be taken at the level of ST5 will also goes against patient safety. Fraser competency. Fail to involve senior at an appropriate time. Fetal movements. Folic acid in pre-pregnancy care. Gum reference. With gum reference, the following safety points will automatically come to your mind: partner notification, STI screen, treatment with antibiotics, contraception. H. High dose folic acid. What are the conditions where you will be prescribing high dose folic acid? Previous entities, diabetes, BMI more than 35, drugs, especially antiepileptics and salicylates, and malabsorption syndromes. I. Incident reporting, illicit drugs, information leaflet, interpreter. J. Justify your decision while making and actions even if recommendations are not completely in line with the established evidence due to patient's wishes or other illnesses. Jehovah's Witness. Most important, knowledge of sound, RCOG, NICE guidelines and TOGs. Last menstrual period. Liaise with the specialist. Legal pathways, especially FGM and LPA. Legal power of attorney. And life-threatening situation to identify and act accordingly. Multidisciplinary pathway. Meo's charting. Mental Health Assessment, Mental Capacity Act, National Early Warning Signs Charts, Never Events to identify from the list, and no scattergun approach whenever you are approaching a station. O, open and honest. Over reassurance or false reassurance can go against patient safety. Prescription and prioritization. These are the two important pieces what we are having. While prioritizing safe drugs in case of allergies, renal impairment, safety in terms of teratogenicity, transplacental transfer of drugs, excretion via breast milk, awareness of altered doses in cases of body mass indexes and renal failure. Prescribing error including allergies, teratogenicity, and interactions. Prescribed doses, routes of administration, risk or side effects commonly used of drugs in obstetrics and gynecology. A qualified personnel should be doing the procedure. Signing off OSATs, that is competence achieved. Red flags. Always remember red flags in each station and please address that red flags. Respect the patient's dignity. Chaperone presence while having an intimate examination. Respect the patient's religious beliefs and cultural issues. Risk management is very important. Safeguarding. Child safeguarding, domestic violence safeguarding, sexual abuse safeguarding involving Marak. STI screen, safe sex practices, self-harm, suicidal tendencies, safe surgery, social support services, smear, smoking cessation. T, test of cure, triage, U, urine pregnancy test, V, vulnerable woman, rule out violence, sexual, domestic, child abuse. W, warning signs and symptoms whenever necessary, WHO safe checklist, weight management services, and the list continues. These are my way of presenting patient safety. You can add on to this patient safety list from your own knowledge, and please update me also. Suggestion for developing patient safety skills as per Lisa Joel book. Spend some time reviewing RCOG guideline on obtaining consent. Thoroughly revise the guidelines about assessing mental capacity and Lord Fraser competency. Practice writing prescription drug charts, intravenous fluid administration charts, and ask your exam buddy to check they are correct and legible. Learn the doses and administration protocols for drugs. Make sure you are familiar with national guidance such as WHO Safe Checklist. Review both adult and child safeguarding principles and process. Think about how audit protocols and adverse events reporting influence your everyday practice. Thank you.